Hello and welcome. Today we will explore how herbal and Western medicine can work together to support neuropathic pain in clinical practice. Our aim is to understand the disadvantages and side effects of current medical treatments and how herbs may help address these limitations. This perspective complements Western medical drugs, enabling true regeneration with a better quality of life rather than offering only temporary relief. Neuropathic pain is typically described as burning, tingling, or electric-like sensations, either spontaneous or triggered by light touch. It often follows surgery, injury, diabetes, herpes, trauma to the nerves and fascia, alcohol use, or chemotherapy. The common ground across these conditions is the disruption of structured water, mitochondrial dysfunction, and sterile inflammation. This becomes clearer through the lens of cell danger response phase 1, which is inflammation. For example, in diabetic neuropathy, excess glucose adheres to the extracellular matrix, altering its osmotic environment through glycation. This leads to the disintegration of the structured water coating around the matrix and cell membranes, acting like a danger signal and triggering a protective response. The same happens in liver and kidney failure as well, leading to the excessive buildup of usually positively charged chemotropes such as ammonia, urea, and creatinine. This emphasis is on excessive amounts of substances. The Chinese call them simply as dampness or Biofield, which disintegrate the structured water grid-like chemotropes. As the cell danger response becomes active, the cell reduces membrane permeability by incorporating saturated fatty acids into the cell membrane. So glucose cannot get into the cell, increasing insulin resistance and reducing nutrient delivery, which starves the mitochondria. As mitochondrial function declines, a low-energy microenvironment develops, and metabolic waste accumulates, prompting sterile inflammation to clear the debris and generate survival energy. Neurons and retinal cells are often affected first due to their high energy demands and because the local microcirculation can be easily compromised by swelling, microclot formation, and inflammation, leading to pain and sensory disturbances as structured water collapses and mitochondria fail. We often view neuropathic pain as a problem of ion channels and nerve fibers, but it is more than that. Neuropathic pain reflects a collapse of the biofield, where the fascia and nerves functioning as a unit fail together. Fascia layers can lose flexibility, become dry, or accumulate metabolic waste, reducing their field scanning abilities. If nerves cannot receive normal sensory input from the distorted fascia, they may malfunction. The nerves and fascia likely lose their structured water integrity not separately, but as an interconnected system. Fascia holds structured water that stabilizes the nerve environment, enabling proper signal transmission. When the water grid overheats or collapses, hyperalgesia and allodynia can develop. In the upcoming slides, we will explore how to clinically mitigate these pathological conditions. Patients with neuropathic pain who undergo surgery often experience further disruption of their biofield. Starting from lower mitochondrial function, these patients experience further decline, leading to the disintegration of structured water layers. This causes tissue swelling, fascia stiffening, and delayed wound healing, all of which contribute to persistent postoperative transitional pain. Gabapentin is frequently used in neuropathic pain management for its role in modulating membrane potential and supporting microcirculation. In herbal medicine, pungent herbs like choihu or bupleurum are said to support membrane charge movement and dynamics in a different yet complementary way, acting like a natural soap, illustrating how different systems approach similar physiological patterns. In herbal traditions, aromatic rings such as in peoniflorin and flavonoids are associated with deeper functions like calming the mind and sedation, because they capture high energy biophotons from an overheated structured water field and lower the system's overall energy level via a Stokes shift-like mechanism. Gabapentin, in contrast, has a saturated cyclohexane ring without a delocalized electron cloud, so it does not interact with the photonic fields, but increases lipophilicity and membrane integration without sedation, acting like a soap. Probably this was the desired action during its development, to get a drug for neuropathic pain that helps by dissipating excessive membrane charge accumulation without the excessive sedative side effects of amitriptyline, which has two aromatic rings and works like an anti-inflammatory drug. Modern pharmacology describes gabapentin as blocking calcium channels, reducing neural hyperactivity and stabilizing membranes, explaining its milder clinical effects. Pungent herbs like choihu or bupleurum contain saponins, which act like a soap, increasing membrane fluidity and reducing rigidity. However, they lack aromatic rings to capture and store overheated biophotons, so they don't have sedative or anti-inflammatory effects by themselves. At low doses, pungent herbs can calm the system by softening membrane rigidity. At higher doses, excessively increased membrane fluidity may trigger a cell danger response and sympathetic activation, worsening the clinical picture. Therefore, at higher doses, pungent herbs should be combined with bitter, cold herbs like bai shao yao or peony, which contain peoniflorin with aromatic rings capable of capturing biophotons and dissipating them at lower energy via a Stokes shift-like process. This will mitigate the sympathetic activation. Minerals like calcium carbonate and phosphate can similarly stabilize patterns and support biophoton dissipation without excessive cooling, helping resolve membrane rigidity safely. Amitriptyline has several measurable effects. It blocks serotonin and noradrenaline reuptake, which stabilizes mood and reduces neuropathic pain. Since catecholamines are synthesized in mitochondria, when mitochondrial function declines and structured water collapses, the the body can no longer produce these neurotransmitters efficiently. Amitriptylines through aromatic rings can capture high-energy biophotons and dissipate them via Stokes shift, similar to bitter, cold herbal flavonoids, reducing system energy and sedation and pain. However, this non-specific action also impacts mitochondria, leading to undesirable side effects. Many drugs' side effects can be explained by their uncontrolled disruption of structured water layers and mitochondrial energy production. When structured water collapses, bulk water imbalance and edema occur. Mitochondrial dysfunction leads to low ATP, causing fatigue, brain fog, and a low-energy environment where metabolic waste builds up, which ignites a sterile inflammatory process on the long term. Since erection is a function of intact mitochondria and nitric oxide production in the endothelium, which also contains structured water, disrupted water grid and nitric oxide signaling may contribute to impotence. Collectively, these changes reflect a collapse of the biophoton field, aligning with what classical Chinese medicine describes as Shen or mind disconnection, illustrating how uncontrolled drug actions translate into systemic side effects. If we accept that consciousness interacts with the body via structured water layers in microtubules and cell membranes, we can easily put the picture together. Lowering order or coherence in the structured water layers may indeed feel like Shen or mind disconnection and a floating experience. Some analgesics, anti-epileptics and tricyclic antidepressants, particularly those that are weak bases, can exhibit lysosomotropic behavior, meaning that they accumulate in lysosomes due to their acidic pH within those organelles and suppress sterile inflammation. While effective short-term, they may create complexities in the long term by cooling the overheated system while also excessively blocking mitochondria in an unintended and non-specific way, hindering natural recovery. Herbal medicine may complement these treatments by supporting mitochondrial function and rebuilding the structured water grid in affected tissues. Herbs can be combined with conventional medications to reduce side effects, enhance therapeutic effects, and in some cases even lower the required drug dose. While online searches may often highlight isolated reports of potential herb toxicity, these cases typically involve excessive doses of single herbs, often used without formula context or supervision. In traditional practice, herbs are rarely used alone. Formulas are designed to be synergistic and counterbalancing, with some herbs amplifying effects, while others temper and guide them. This means that herbs with the potential for toxicity at high doses are instead used at lower, safer doses, supported by other components that modulate and buffer their effects. The key is careful formulation, clinical monitoring, and proper documentation. When used correctly, herbs can help restore biological coherence by supporting mitochondrial energy production, inducing autophagy to clear metabolic waste, and rebuilding the structured water and extracellular matrix grid. Herbal strategies may improve quality of life by mobilizing edema, aiding weight regulation, sharpening mental focus, and restoring everyday energy. The following herbs are often used in neuropathic pain management. Corydalis yanhuswa, which is used to relieve pain and spasm. Dan Shen on Salvia miltiorisa, used to clear microcirculation and restore potential endothelial structured water coating and nitric oxide release. Bai Shao Yao or Peonia lactiflora as an anti-inflammatory herb. Gou Teng or Uncaria ringophylla used for fascia relaxation. Fulling or Poria cocos used to digest metabolic waste and drain ballast water. They all can be combined to support field-based neuropathic pain management, gently warming a frozen damp cold syndrome back into life. Corydalis yanhuswa can capture and dissipate biophoton excess while integrating into membranes to modulate fluidity, explaining its antispasmodic and analgesic properties. Yanhuswa combines bitter, pungent, and warm qualities. Its aromatic rings may capture excess biophotons, while its pungent and warm traits increase membrane fluidity by inhibiting lipoxygenase and stimulate mitochondria, facilitating biophoton emission and restoring the structured water grid charge coherence. Gou Teng Uncaria ringophylla is said to calm the liver wind, which is essentially excessive and chaotic emotions, and neural hyperactivity by blocking NMDA receptors, dissipating overheated membrane charge, and stabilizing structured water around neurons without heavy sedation. While it contains an aromatic ring, the ratio to the whole molecule limits excessive cooling, while its amphipathic properties help restore membrane fluidity like a soap in neuropathic pain contexts. Supporting recovery involves pairing herbal approaches with chiropractor treatment, fascia work via tuina, reducing meat intake and in diet and emotional release. In this combination restores water coherence in the fascia nerve interface and addresses neuropathic pain at its roots. Neuropathic pain is not just a nerve issue, it reflects a collapse of the fascial field. Fascia and nerves function together and need to be rehabilitated together. Herbs are given to calm and support the overheated and damaged water grid and nerve sheath. This way, the focus is shifted from excessively cooling and separately controlling the natural hyperactivity we call allodynia and hyperalgesia to comprehensive and overall understanding of the real underlying pathology. These patients usually have subtle clues of metabolic waste accumulation we can read via a thorough clinical observation. Overweight, emotionally traumatized and depressed with chronic sinusitis and nasal discharge, diabetes, liver or kidney disease which produce excessive amounts of positive cheiotropes to destroy the water grid, smoking and eating a large amount of meat that maintains inflammation and sulfate supply in the gut, chronic cough, vaginal discharge, arthritis as a sign of waste deposition in the joints, and recurrent infections. We have explored how integrative medicine views neuropathic pain within the fascia neural matrix. by combining temporary sensory modulation, targeted nerve blocks, and herbal formulas that restore fascia scanning and sensing, we can avoid the functional losses associated with permanent blocks. This approach offers sustainable pain relief while maintaining movement and quality of life, respecting the body's natural healing mechanisms.